Welcome, everybody. Today, our second section is about stress reduction in the workforce. I'm pleased to have Dr. Netta Gould from Johns Hopkins Medicine and Dr. Pete Bucher from Behavior to talk about a new product that they're working on for the employees in the workplace. So with that, I'll leave it to you guys. Take it away.
Yeah, thanks for having us today. I want to. My name is Pete Bucher. I'm the Chief Medical Officer of Behavior. We are. I'll give you a little bit of background, but I really don't want to talk so much about our company, but about what we're doing and what our vision is for the product that we're working on with Dr. Gould and Johns Hopkins, as well as kind of how we see digital therapies and their importance in the current healthcare landscape and as we move forward. So just to set a little bit of context. So I'm an orthopedic surgeon by background with dual doctoral training in mind-body medicine. So I bring that to the table. I've been with our company for about 3 years. And Dr. Gould, do you want to go ahead and introduce yourself, and then we'll get rolling?
Hi, I'm a clinical psychologist at Johns Hopkins, and I work with adults with anxiety, depression, and staff members and employees who are experiencing stress and burnout.
Okay, great. So I will go ahead and throw up just a few slides to kind of set the context for the discussion, help you understand our worldview and how we're approaching this project, and then why we think it's so important. So here we go, not to get crazy with slides, but and we really see this as workplace and beyond. So just to kind of get everybody on the same wavelength here, we really see our company is about 4 years old, and our founder Aaron Ganny was the Chief Technology Officer of Humana for about 12 years, and so we really came to this company wanting to address behavioral health in a meaningful way. I saw in my clinical practice and what he was seeing on the insurance side, we just saw so many people kind of falling through the cracks of traditional healthcare and the way that it's set up. And we really wanted to do something meaningful to impact chronic illness. I had a big interest in inflammation, chronic pain, that kind of stuff from my clinical years, and just wishing I had better tools sometimes to help the people I was seeing. And so we really identified this need, and we see that, of course, healthcare spending is escalating out of control. A huge chunk of that is chronic disease, chronic illness, but really the big burden that we're looking at is this idea of behavioral health. And we see behavioral health as being at the source of most of the biggest difficulties and what I call kind of black box diagnoses that we just don't have great solutions for a lot of times in healthcare. So with 1 in 7 people having a diagnosable behavioral health condition with over $1 trillion of productivity lost every year, this is a real problem, not only in healthcare, but also, of course, in the workplace. And what we're seeing, of course, in this time, and I'll just direct you to the bottom of this slide, what we're seeing at this time from July of last year to July of this year, of course, the pandemic being a big part of this, is that we've had more than triple the amount of people in the US reporting symptoms of anxiety and depression. So this need to meet the scale of the moment has never been more profound. And we see this integration of digital as a frontline therapy option, or even digital wellness option, as being something that is scalable, that can help meet the demand, whereas sometimes humans aren't. It's hard to get more humans through training, or it's hard to get more facilities to open to meet the demand, particularly at this time where in-person care is a very challenged interface. But digital, with the right solutions, with the right partners, with thoughtful development, can meet that demand. And so we see the sort of the patient being the center of this matrix of, we got to have the right devices, we got to have providers, and we got to have people to pay for it. And somewhere in the middle there, hopefully at the center of the conversation, are actual patients who often, in the way we've been set up, have increasingly been getting left out of the equation and the decision making. So we came at this with wanting to use technology to meaningfully address a problem. And so we see virtual reality as providing a particularly powerful medium for a lot of the elements of behavioral health that we're trying to address. So we sort of see this triangle that we're trying to meet. How do we use the power of the technology that we believe strongly in? How do we improve access to care for patients who may not otherwise get it, or maybe challenged to get it, particularly in the way that healthcare is going to be set up as we move forward. I always say post-COVID, but then I'm like, are we ever going to be really post-COVID? I don't know. It remains to be seen. So the power of technology with improved access for patients who need care, and then containing the cost of healthcare in the process. And so we see that, let's see, sorry, there's another part, here we go. So we see this power of VR as being a very significant way to do that. And so how we do that today, again, I told you I have this training in mind-body medicine, so really interested in the role of chronic stress, which is our topic here today, right? The role of chronic stress in many of the, not only behavioral health, but many of the chronic health conditions that we pay a lot of money for and that people suffer with greatly, that just kind of go on and on and on and on. So we see this sort of central core of stress relief as being key to promoting health and helping contain costs, provide access, and as a meaningful use of technology. This slide just to say that we sort of believe in this sort of vicious cycle people get stuck in with a physical illness, whether it be a chronic stress activation, whether it be physical injury leading to chronic pain, whether it be issues with addiction. And we see that, the thoughts, the cognitive component, the emotional dysregulation that comes, then feeds back into the physical dysregulation, and on we go in this vicious cycle. And we believe that we can intervene at any of those levels to bring meaningful change. So what we do, so the core of all these programs and how we think we can meaningfully affect behavioral health and chronic conditions is to really work strongly on stress resilience and emotional regulation as sort of the central core. And to do that, we sort of layer this in three components, very germane to the conversation today. We like to teach people a very simple way at the beginning. Okay, well, here's what stress is, and this is what you feel when your body's in stress mode. And then here's a simple way that we can start to bring you out, sort of do a parasympathetic activation to bring you out of that stress mode, to bring your body back into balance, literally. And then we sort of build some skills with how to notice when you're being triggered, how to know what those triggers are, how we can teach you some emotional regulation exercises, which we can support in real time using biometrics, which I'll show you in a second. And then third, we can do exposure therapies, and we can actually teach people how to use these new skills, how to encounter life scenarios that might be triggering or stressful for them without actually having to experience them in real time. And we can actually dial in the dosage of that exposure, so to speak. We think VR is the way to do that, because if we're doing standard approaches to CBT, for instance, or if we're doing interventions using a smartphone where you have a two-dimensional device, a lot of that goes through this sort of top-down pathway in the brain. You sort of imaginal therapy, where you're seeing something on a screen, but your environment is the same. I'm still sitting in my living room with a phone, learning about some topic or getting exposed to some stressful situation. But when I'm in VR, we encounter these stressors much like we do in real life. It's this sort of bottom up. So we get the whole experience of being triggered, but in a way that is controlled, contained, in which we know that it's a simulation, but our brain really doesn't know all that well, because again, it's encountering it as it does in real life. So we feel like we can really teach people, we can educate them, we can motivate them for something new, and then we can really activate them to teach them how to encounter these stressful responses in real life. And to show you how we deal with access and just to give you a sense of where we see this partnership with Johns Hopkins, for instance, going, is we see an opportunity to use digital as a first line in the workplace, in the home environment, in the clinic, wherever, basically meeting patients where they are, maybe where they are incurring those stresses, whether it's at home, whether it's at work, or what have you. And providing this end-to-end experience where providers and patients can meet somewhere in the middle, but often digital may be the first line defense. So the whole point of that is that we like to create these strategic partnerships with content domain experts to create thoughtful programs, meaningful programs, taking what the best of the best, like Dr. Gould and what Johns Hopkins is doing in this domain, taking the best of the best and then putting them in a digital environment to meet people where they are, to give them the best access to care. Whereas somebody, hundreds of miles away may not be able to come see Dr. Gould in the clinic or take a mindfulness program at Johns Hopkins physically, but we can actually transport them there in the digital environment so they can get that intervention in a meaningful way. And then having access to clinicians on the other side, should they need them, is an important part of that setup. And also, and this is just to say, we're meeting people at home, but directing you to the right side of that slide, which is to say, then having the capacity on the back end of the experience then to deliver information in real time back to the health records, back to the providers, giving access to telehealth, which has been so important, of course, during COVID. And then how do we lower costs? Well, this is a busy slide just to say, the way that we deal with cost is we provide, again, ready access to conservative care solutions for many of the problems that people are having. So if somebody's having a lot of anxiety, then we can meet them in a place of digital. If we can triage them in real time in the digital environment, and we can decide, okay, yes, this patient is has an acuity situation that needs an actual human, good, we can forward them on. But if it's somebody who comes in and says, I'm just feeling really anxious, I don't know what to do, they may or may not need to actually see a real human in real time. So we reserve that human resource, that provider, for people who are maybe in a higher state of acuity. And then we offer a digital solution, or they say, yeah, I need to speak to a human, and we get them in a queue to speak to a human. But in the meantime, we deliver a digital solution. They say, you know what, I feel actually a whole lot better. I think I can go with this. Then the provider might say, well, why don't you go ahead and do this stress program, and we'll work on your chronic stress. Then why don't you meet back with me in a couple of weeks and let me know how it's going, for instance. So there's a way to actually use the scalability and this interface of digital to offload an already overburdened system, provide access to people, so not having to wait for several weeks sometimes to get into a class or meet a provider, and also then to provide low-cost scalable solutions that may do just fine with some oversight of a thoughtful and knowledgeable clinician. We're sometimes referred to as digital therapists, people who are knowledgeable in the ways of how to use digital solutions. So to say that we're in this partnership with Johns Hopkins is really important, but it's also a part of the bigger goal that we have. We don't see these partnerships, this particular partnership, as creating a cool product or creating something, just creating a meaningful product. We see this literally as changing the landscape of how healthcare will be delivered in the future. We really see providing a more accessible interface, so maybe a more user-friendly interface for both patients and clinicians. And we think if we're going to do something meaningful to combat the problem of chronic stress, to provide these meaningful solutions, that we have to meet the needs of the patients, we have to meet the needs of the providers, we have to meet the needs of all the stakeholders in between. And so this idea of providing solutions, as well as collecting information, providing feedback through biometric data, so we can understand what the patient's stress level is in real time, and then provide the next piece of the program, literally designed to the patient or to their own motivation. So that's how we see digital, and that's how we're approaching creating these programs in VR, because we think it's a very powerful way to deliver a technological or digital solution right to where the patient is. And so many people today are in crisis, and then they say, okay, well, I'm in crisis, and I call my therapist and I can go see them in 6 weeks. Or, the system is just under a tremendous strain, as we saw in the early slide. So we see this as a meaningful way, and working with a partner like Dr. Gould, these are really exciting things for us to develop these programs, because we know that we're providing high quality solutions to people who sometimes are in extremis and really need them right here and now. And so with that, I'll show you Dr. Gould in the virtual environment. So we can bring you into a place where we take you out of your stressful environment and put you somewhere else, literally in virtual reality, where you can meet Dr. Gould here in this sort of hologram form, where she can teach you, she can guide you into a reflection. We can literally send you right through that gate and into that field to be in a peaceful space to do that next piece of the reflection. And so with that, I'll turn it over to Dr. Gould, let her explain what her approach is, how she goes about this, and then we can kind of come back maybe to a little final discussion on our collaboration and take any questions that the audience may have.
Thanks so much, Pete. So I wanted to just give a little bit of background in terms of how I connected with behavior. So as I mentioned, I'm a clinical psychologist and I direct a mindfulness program at Johns Hopkins, and I lead mindfulness courses. Some of them are well known, such as the Mindfulness-Based Stress Reduction Program, which is an evidence-based program. Some of them are ones that I've led, and these are highly effective programs. So from my data and the thousands of research studies that have been done, we see decreases in burnout and stress and improvement in depression, anxiety, and chronic pain, among other factors. The issue is exactly what Dr. Bucher mentioned, is that not everyone can have access to these programs. So to give you a sense of that, I'm the only certified mindfulness-based stress reduction provider in the entire Johns Hopkins medicine community. And so the people who come through my course, really, the data show they do great, but many people can't come because of the time commitment for the courses, accessibility, and of course now COVID has hit and everything is digital. So I connected with Johns Hopkins Healthcare Solutions. And if you're not familiar with that entity, it's a business team within Johns Hopkins Medicine that helps take ideas and research-based products and bring them, help faculty develop products and bring them to the marketplace. So I connected with them, and by way of that connection, connected with Dr. Bucher and behavior. And so the idea is, how can we address this issue of stress, which is a pandemic in and of itself, in a way where people have access to some of these resources when they need them? And so we know the mindfulness program is incredibly effective, the mindfulness programs, but you know, the virtual reality we believe is a way to really bring it to more people and address some of those issues that Dr. Bucher brought up, so that this isn't accessible otherwise to others. And we think that it could be incredibly effective to addressing some of these, the health crises and the gaps in the mental health system. So the product is a six session virtual reality immersive experience in mindfulness for purposes of stress reduction. And it's targeted to employers, employees, and employers can purchase the product for their employees and as part of a bigger program, and they are assessed for their levels of stress, and then they can be connected with the virtual reality headset. The 6 sessions are about 30 minutes in length, and the idea is that they'll be done once a week with practice via a mobile app in between sessions. So I think that's pretty much kind of the overview, and we can kind of open it up for questions that we can.
So I guess a couple questions. So Dr. Bucher, who are Behavior's typical customers now? I mean, it sounds like working with Johns Hopkins, you're focusing on employers, I think, but who are your current customers?
Yeah, so to date, our solutions have been, we have the stress solution, which we have a sort of preliminary version, and we wanted to really do that justice. And so we have this collaboration with Johns Hopkins, but we have the stress, we have the addiction recovery augmentation program, we have a chronic pain program, and we're excited to have just announced that we're releasing a perinatal program that will cover the 3rd and what they call the 4th trimesters of pregnancy. So kind of that with delivery in the middle, the 3rd trimester, then that first 8 weeks with baby at home, to help combat perinatal mood and anxiety disorders. So those are our existing products today. So our consumers most of our programs have been deployed in clinics. For instance, the chronic pain program is typically deployed in physical therapy clinics, people who are having physical therapy for chronic back pain or other painful conditions. That perinatal program really marks the shift for us to going from in clinic to in home. So we have to date partnered with big clinical entities. So we have The chronic pain solution is in over 150 physical therapy clinics across the country. We've serviced over 5,000 patients through that. We have the perinatal. So typically it's been clinical partners. But we really also are targeting, like you said, employers for this. And then also, we're also working very closely with a couple of big payers to really, who understand the benefits of this. And we're working to some pilot programs with some of the big payers to pilot this in some of their populations of patients to see if we can really prove that value proposition that I mentioned, that yes, we think we can save you money by providing scalable, conservative care pathways for patients that don't take up space in the physical environment, or with your providers, allowing them to take care of the people of higher acuity. So we really think we can meaningfully impact that, and we're in the process of showing that to a couple of payers through pilot programs.
We had a question from the audience. Are people able to meditate or do breathing exercises while they have the system on?
Sorry. Yes, absolutely. So the whole premise behind this program is to teach mindfulness meditation, which includes focusing on the breath, but a variety of practices. And and one person I see in the chat also asked why VR and not other methods. So yes, these programs are available in other methods. This is novel. Mindfulness has never been presented in this capacity in a virtual reality setting. And what we believe is that the immersive nature of it will help teach the skills better, because the skills of mindfulness, while very, very effective, are challenging. And in this way, we're hoping that we can really engage the parts of the brain that Dr. Bucher mentioned in an immersive environment, and have people learn this skill in an easier way, and also attract people who otherwise may not be attracted to this concept.
Yeah, and the
Go ahead.
thing about doing mindfulness in VR, and again, the literature that's out there is pretty sparse, and a lot of it is sort of observational or anecdotal. But there's been some interesting looks at what does it mean to do mindfulness in VR. And what we do know about it is that we can very effectively induce a deeper sense of presence, of being here now in the experience. We know that we can positively affect emotional states. So we can basically, I don't want to say induce, but greatly support condition of state mindfulness. And so we believe that if we can induce state mindfulness, so we can get somebody into the experience of what it means to experience mindfulness in the here and now, that we can then help translate that into, and through a progressive multi-session experience, we can then sort of help transition them into a deeper state of trait mindfulness, where they're actually experiencing it in their everyday life. So that remains to be seen. No one has taken that leap as far as the research goes, but we have seen it. And so we believe that we can certainly do it with a program like this.
Dr. Gould, talk a little bit about kind of what do you said it's 6 sessions, 6 VR sessions. Mm-hmm. What do you expect a patient, like what do you expect them to gain over the 6 sessions? And is there sort of a residual effect beyond the 6 sessions? What do you expect out of that?
Yeah, so what happens is that each session can stand in and of itself, but it also builds. A person on the initial session comes and gets some background on stress reduction, on general stress and how it impacts physical and mental health. And then we begin with some brief practices of focusing on the breath as a means of mindful awareness and stress reduction. Following that, we introduce in the next session kind of a recap as well as a reflection on what people noticed by practicing, and then going into the next practice, which is a body scan meditation. And so there are different meditative practices or mindfulness practices in each session, and the person is instructed in between to practice and then reflect upon what may have changed as a result of those practices. And then there's also skills about bringing mindfulness to daily life as well, outside of the formal meditation practices. And the the hope is that, you know, from what we see from the research is that these become tools in a person's toolbox that they can access following, you know, following the completion of the program, and that they can call on these tools during periods of stress more readily because they've been trained and to practice them for this intensive immersive experience.
Yeah, and we believe that's the
And so,
value, real value on the back end of the VR experience is the ability to actually, again, expose them to stressful situations and allow them to practice. So we see this as a particularly powerful way to not only take what you're learning on the cushion, so to speak, and really translate it into everyday life, which is the place where it really matters. So we think that VR actually is maybe the ideal medium to do that.
yeah, and I think, you know, it sounds like you could also kind of go back and revisit. I mean, one of the beauties of VR is I can go back and redo something if I didn't feel like I got it, or I'd like to do it again. I know there are studies that have been done by similar but not the same, but studies done at the University of Maryland talking about the retention rate of somebody who does a VR training session. So they're trained to do something, and the retention rates are much higher. I think somewhere in 50 to 70% higher than traditional training methods. I would expect you all would think something like that would happen as well, that this would be, you know, these sort of mindfulness capacities would stick with people better over time.
Yeah, it goes to that slide I showed on the brain. I always say the difference in doing something, you know, on a smartphone, or sometimes honestly even in person, if you're trying to learn something cognitively, it's the difference between somebody showing you a picture on their phone of a pretty sunset and being on the beach experiencing the pretty sunset. You can't really compare the two. So the learning that happens in VR is very experiential. It's like I've done something, I've experienced it, and we remember it in that way. We engage the emotional centers, we engage all the centers of learning, as opposed to trying to get past this barrier of what I already know, what I'm expecting to learn, what I'm wanting to learn, the overwhelm of information. We can literally flood the person's learning capacity with data and have them retain a large amount of it in VR.
And the other thing is that, you know, this is novel, this application of it is novel. And so our hope is to be in the forefront of the research behind it as well, where we compare this to different modalities and to, you know, show in a more specific manner that this is effective.
Yeah, so I want to just hit, there's a couple questions here I want to hit. I don't have a video of the actual experience today. The program that we're developing with Dr. Gould is very much in development, and we hope to have a sort of a proof of concept version by mid-October, with the final version being available, or at least the first iteration of the actual clinical version being available by January 1. But we do have videos and demos of some of our other experiences. So you have my email on the speaker listing there. So feel free to email me and we can send you a video, anybody who's interested in that. The other question was about time. Typically our 6 sessions, our pain experience is 12, but most of our experiences, the sessions are somewhere between about 15 and 20 minutes. And then our vision for this one actually is that they will have some opportunity to spend additional time. We have this environment in which they take these programs. It's called their happy place inside once they go in. And it's their own somewhat, and we're working on actually increasing the capacity of this, but customizable location, like a maybe you're in a mountain chalet home, maybe you're at a beach, depending on what you enjoy. And then there are certain things that you can use to customize that environment to make it feel more homey for you. And so the idea is that they can learn these skills, they can learn about stress, they can learn about mindfulness, they can practice. And then if they choose to, they can spend some additional time in the experience. So when we say 30 minutes, there's some of that is built in optional time that we'll give them for deeper reflection or just to sort of be in a more less stressful environment.
And the first session is actually longer toward the 30-minute mark because we provide a lot of background, and then the subsequent sessions are truncated.
Okay, any final comments? All good? Thank you, Dr. Bucher, and thank you, Dr. Gould. This was really fantastic and super interesting, and I look forward to seeing the final product. This should be very interesting and help a lot of people. I think certainly in this age of COVID, we're all experiencing a lot of stress, and certainly addressing those stresses between actual physical clinical visits will be critical, sort of the healthcare system of the future as we see it. So thank you both for your time and taking time out of your busy days to be with us today. We're going to have a 10-minute break until 11 o'clock. Actually, I guess we're down to 8 minutes. And the next speaker will be Dr. Brennan Spiegel. That will be in the main session. So you'll need to go to the Maverick 2 session to join him. Dr. Spiegel comes from Cedars-Sinai in Los Angeles, and he'll be talking about lessons used using virtual reality in clinical settings. After that session, you'll then come back to this healthcare track that will continue to run after lunch, right at 12:15. Thank you both. Thanks, everybody. Appreciate it.
Thank you.
We will see everybody after.